Hey there, Shruti here with another episode of Women of Communities Take 10. Our guest today is Dr. Maybank. She's the inaugural Chief Health Equity Officer for the American Medical Association. Before coming to AMA, Dr. Maybank was the Deputy Commissioner for New York City Department of Health and Mental Hygiene. This amazing woman of community has also done a lot of representation work. She co-founded the We Are Doc McStuffins movement. In addition to all of that, Dr. Maybank also teaches medical and public health students on topics like health inequities, physician advocacy, leadership, among other things. Let's bring up Dr. Maybank. 1 second. Hello, Dr. Maybank. I'm so excited to interview you today. Tell us, what communities are you supporting and how are you supporting them?
I'm a physician by training, pediatrician and preventive medicine specialist. Really, most of my career in health has been less about seeing patients. I saw patients for maybe about 2 years early on as a pediatrician, and then always knew I wanted to focus a little bit more broadly on what really creates health overall. And the reality is that the healthcare community wasn't appreciating well enough where the conditions of which patients were coming from and where they lived, and how conditions were set up in a way that couldn't support them to be healthy, right? And there's much more conversation around that, and I think acknowledgement of that by the healthcare community now, but not at that time. And so it really pushed me into the public health space and the public health community. And then now being over at the American Medical Association and seeing this evolution in healthcare, I think, healthcare is trying to figure out what is their best role. For me, the communities that I serve then becomes much broader, right? It's the American Medical Association. Primarily we're an organization that's representing physicians across the country. And that's our primary audience, to make sure that we're helping support physicians and to be a powerful ally for patients and patient care. And in the space of equity, really centering the folks who are most marginalized, that do not have the resources, are not invested in, are oftentimes blamed for their conditions. And diversity is important, inclusion is important, but power is important. And often power is left out of the conversation. Power of who can make decisions, but also power to move money and redistribute money and invest, right? That's really the core of what makes change in our society, and it influences so much.
Can you tell us a little bit more about your journey in getting to this place? What did that look like? And if you can specifically call out some risks that you had to take or rules that you broke to get to where you've gotten to.
I don't know if I mentioned specifically, but I worked 2 years as a hospitalist, decided to go back and get a second residency after pediatrics. That put me in the space of public health preventive medicine, which then drew me into governmental public health. I also feel there's an element of following my gut, taking the risk of, me saying I'm not practicing medicine anymore because it's not what's bringing me the greatest happiness. And there's something wrong with the system from my perspective that I couldn't even see how I was going to be happy. And so I knew for me that I need to make a decision. And it's a risk to say you're not going to practice medicine as a physician. I mean, my mom to this day still doesn't quite get it, I went to med school, I'm supposed to be a doctor, but I knew it wasn't right. But I also didn't know what it meant, and where it was going to take me and where I was going to go. But I think for many of us, we have to look at where we've come from, in the sense of I've landed on my feet. Things have been hard maybe at times, but I've always landed on my feet and been able to move forward. So just having confidence in that, allowed me to take that risk at that time. And I always felt there was enough support and protection. I get not everyone has that. And that was a privilege that I knew I would be okay, because there are certain supports around me that were going to allow me to be okay financially, et cetera. For me, I have been blessed. I think following my gut, having amazing people who have absolutely believed in me sharing what I want to do and don't want to do, being explicit about that, I think has also been really helpful. And I think as women and women of color, we have to do that. There is risk in doing that, but I don't see any other way. And I'm sure part of it comes from watching my mother, and I've had some other really great leaders that I've been mentored by and worked for, that also women of color who have stood up in that way. So that has provided confidence for me, which I know not everybody has either.
You're bringing up a theme that I hear oftentimes, which is feeling you have the power to advocate for yourself. I love that you said, I communicated, I said what I wanted. I didn't know what the outcome was going to be, but I identified and I said it out loud.
I mean, and some people may be very clear about what dreams are. I'm not clear about what it is that I'm becoming in my life. You know what I mean? I'm not. I want to move and create big change. That's what I know.
I've heard this a lot from sort of newer generation physicians who are like, I don't know if I just want to do that. Like, I want to do other things, but I'm not quite sure how I do the other things. It's like the pathway. And when you're conditioned in kind of these really structured steps for years and years and years, that gray zone can be so uncomfortable. So that is a huge risk for physicians.
And they're told that it's a gray zone. And is it really a gray zone? Not really. It's just a narrative that's out there by folks who feel this is the way it should be done, and we have to be able to evolve and grow from what has been normalized and things that have been normalized that have been harmful. We have to step into that space of challenging dominant narratives and malignant narratives. Young people to me are very inspiring. They are growing up in a different time of understanding what advocacy really looks like on the streets, and collective activism. And I think they're understanding that they can bring that into the institution. But there are narratives that are put out there. It's the sustained power in the hands of a few. As women of color, I feel we have that creativity, right? And we pay attention enough and listen enough to know how to push. There are probably so many ideas out there that are just not tapped into or just not evolved, that women of color and leaders have because of all the fears. Not only the fears from internal fears, but there is also the fears from the external folks who are telling them no. The hierarchy of human value based on skin color is still very present in everything that we do, with white being on top, also known as white supremacy. And so, what we do to dismantle that, at least see it and name it. And then, when you start to speak about venture and capital and innovation, then you also have to speak about the impacts and the intersection with capitalism and its roots in white supremacy and racism. I'm at the point in my career, and I've been privileged, I think I would say, also to have the space where I can name white supremacy and racism and all those things and not have any backlash towards me, in my profession and where I work. I get that is not the case for everyone, but hopefully this inspires folks to know that you can still stand on your 2 feet within these institutions and do so, especially if you can explain it so that folks can understand how it shows up.
Are there any women of community in your world that you'd like to give a shout out to and spotlight?
Dr. Joya Carrere-Perry, she's an OBGYN, considered definitely a national leader, specifically around reproductive justice. And Dr. Rachel Hardman, who is at the University of Michigan, bringing in kind of methodology as it relates to critical race theory. There's Oni Blackstock and her sister Uche Blackstock, Dr. Kamara Jones, a legend in the space, Dr. Mary Bassett, also a legend in the space of equity, Dr. Manisha Sharma, who is a very good friend of mine, but she's kind of she's like the Olivia Pope of medicine, really. Alice Chen, also another physician, really working lots on kind of vaccine efforts. There's Dr. Alice Stanford, who's doing amazing work in Philadelphia and then getting the vaccine out with many people. There's Lash Nolan, who is a medical student who amazing and powerful voice. There are many amazing women and leaders in my life that I've learned so much from.
I've had so many years of where there's a panel being organized or something, and the statement is said of, well, we don't know any people of color. We don't know any women of color.
Oh my goodness, right. Yeah.
Right. And that's just not true. And so I make it a point to ask this question to everyone that I interview or talk to, because there are plenty of women of color doing fantastic things. So for audience, check out the comments. There's a link to all these people, and please do follow them, follow their work, and support them. For people who are watching who would like to support you, what is one actionable thing that they can do to help accelerate your work?
Yes, well, this is really good timing for that question, is that, we are coming out with our strategic plan. It's actually AMA's first strategic plan on equity. We just would love for folks to check it out, to read it, to share it, to provide feedback, and then also to hold us accountable as the American Medical Association.
Check out the comments for a link to that report, and please do check it out. Dr. Maybank, it's been an absolute pleasure. Thank you for taking the time. Really appreciate it.
Oh, no, thank you. It's an honor. I really appreciate spending it with you. Thank you.
Yeah. And to the audience, thank you again for watching another episode of Take 10. Until the next time, bye.